Hi, everyone. Welcome to Provider Spotlight. We are back this week interviewing more amazing docs and private practices. This week, we have Dr. Dave Wilderman of Wilderman Physical Therapy in Wilmington, Delaware. Dr. Dave graduated from University of Delaware. He achieved his master's in physical therapy at Arcadia University, and he achieved his Doctor of Physical Therapy degree from Boston University. You were a very busy man. And so he provides expert physical therapy care by focusing on the source of the problem to help you keep active, mobile, and most importantly, free of painkillers. So welcome, Dr. Dave. Thank you for being here.
Thank you very much for having me.
Yes, we are excited. So let's get into it. So tell us, how did you get into your specialty? What prompted you to get started in physical therapy work?
Well, I've always been interested in the healthcare field.
Mm-hmm.
And I thought at one time I wanted to be a brain surgeon. That was my childhood wish, until I realized that doctors don't have much free time. And I thought, how could I best help people? But still, at the time, I didn't want to work nights. I didn't want to work weekends. I wanted to do things on my own terms. And somebody had said, what about physical therapy? And I said, physical what? I had no idea what physical therapy was. And when they explained what it was, I thought, wow, that sounds kind of cool. So I actually contacted a physical therapist, and they said, well, you could come shadow. And what I actually did during high school was I spent one summer shadowing 4 different physical therapists in 4 different facilities. And I knew by the end of that summer, if there was any aspect of the field I didn't like, I knew that was not the field for me. And I just fell in love with it. I just loved the notion of being the go-to person where you can solve problems. Everybody's different.
Sure.
And it's like putting a puzzle together. So it's trying to figure out this piece and this piece, and you get to know the person. I mean, you see the people, 2 times, 3 times a week, as opposed to being a doctor where you see them maybe once every 6 months or once a year. And you get no rapport with people. So
you're invested.
Yes, that's what really got me involved with the field.
That's all. I love that you shadowed 4 people in one summer at such a young age. That's incredible to start your career from that point on, and knew that's what you loved at such a young age. So I commend you on that. That's amazing. So what often prompts people to reach out to you? What are their main concerns? What do you see most often?
So with me, having been in the field for over 36 years now, I mean, I have seen a big evolution to where pain is not the reason people come to see me. First of all, I now am, people that gravitate towards me are typically chronic pain people that have failed in other aspects of rehabilitation, and I'm kind of like their last resort.
Yeah. And
I don't use pain as a motivating force, because people will live with pain forever.
Yeah.
I mean, and I won't see the person that has had back pain for 2 years, but I will see that person when they can no longer walk 18 holes on the golf course.
Yeah.
Or the person who can't go through the grocery store without having to lean on their cart because of sciatica or because of stenosis,
right.
That can't perform their normal everyday functions. So once independence is threatened, once mobility is threatened, then that gets people's attention. But pain in and of itself, generally, no. People look for the next big cure, the next big, the promise of pain relief and
fast fixes and things like that. Yep.
It's amazing what people will, what will grab people's attention, and just in the hopes of a quick fix. But we also know in the physical therapy profession, we know that only 10% of people really need our services now.
Yeah.
And the problem, Rachel, is that human nature is reactive. It's not proactive.
Yeah.
So when I do workshops, if I do balance and fall prevention workshops, I do low back pain and sciatica workshops, I don't get people that that have never fallen in my balance and fall prevention workshops, because they don't see the need. I get the people that have fallen that don't want to fall again.
Yeah.
And what I tell people is, you go to the dentist twice a year, whether or not you have tooth problems.
Yeah.
You go to your auto mechanic every 5,000 to 7,000 miles to get your oil changed if you don't have an electric car, whether or not you have car problems. How many people come to see us, the experts in the musculoskeletal system, for a full body tune-up? We can do movement assessments. We are the musculoskeletal experts.
You're so right.
You don't, because people don't see the need until
it's a big
something
problem.
happens. Yes.
Yeah, it's a big problem, but it's true. We do go to the dentist twice a year because it's routine. It's follow-up. It's, making sure there isn't something, you're checking our gums in case, you do maybe have an issue, or you could have an issue, in the future, but you're making sure you don't have it now. It's all preventative. And
Correct.
Why don't people do this now before it doesn't have to be the big problem later on? If you can get a hold of it and focus now and be better off later on, why don't we all do that? It's a great question and a great answer.
Well, because human nature doesn't focus on the positive. Human nature doesn't focus on being healthy. Human nature focuses on, being sick, or, we really shouldn't call it health care. We really should be calling it sick care, because that's what we're dealing with. We're not dealing with the healthy individuals.
1,000%. Now you kind of maybe had answered it, but you might have a secondary answer. What is the biggest misconception about what you do?
The biggest misconception about what we do is that people have no clue what physical therapy is.
Yeah.
I mean, when I promote my services, I am a movement specialist.
Yeah.
I am not a physical therapist, because people don't know. People don't know what it is. If you ask somebody what a chiropractor is, they know what a chiropractor is. If you ask somebody what an orthopedic surgeon is, they know what an orthopedic surgeon is. Even a massage therapist, even a personal trainer, people know what they do. They don't know what physical therapists do. So, I mean, we restore mobility, we restore function. That's what I explain to people. But if you just ask people at random, what's a physical therapist? I've gotten all kinds of answers. Oh, you do exercises, right? Oh, you give massages, right? It's like people really don't understand. And I mean, a big problem comes down to the APTA. I mean, with not branding us. I mean, it goes way back. It's just an ongoing problem that we've had, where we have not marketed ourselves, well, as a physical therapy profession.
Yeah, no, I mean, I love that what you're saying is very palatable. People can understand that. They can hold on to it, they can grasp it, and they can say, yes, now I understand, is that you are going to help me in my day-to-day journey of whatever I'm doing, move better, feel better. That makes a lot of sense to a lot of people. So I love that you're branding yourself as such, because it makes sense. And it
has to be what they want, not what I want.
Yeah.
The goals have to be individualized for the patient. It has to be what they want to do. It's not what I want to see them do.
Sure.
I mean, I will have people that have a knee replacement that their goal is to be able to climb a set of stairs. That's it. They want to be able to climb stairs pain-free, versus the person that wants to get back to a running program, or get back to playing pickleball. It's huge, the differences that people have in goals, and we cannot do a cookbook approach. We can't treat everybody the same.
No, and I'm sure other physical therapists might do those things, which leads me to my next question is, kind of maybe have answered it, but how does your practice differentiate from others? And what is about your method that you feel is different, and how you work with patients is different than, maybe some of your colleagues and people in your field?
So what I don't do is I don't utilize modalities. I do not use hot packs or cold packs. I don't use electric stim. I don't use ultrasound, because in the research, they are all palliative. They make you feel better. They don't solve your underlying cause. So when I talk to, I say the same thing. If people are in pain, I tell them, take a pill. I said, medication does the same thing. It treats the symptoms. I said, if you want to get to the root cause so that it doesn't come back, that's where I can help you. So I spend my time doing one-on-one, hands-on manual therapy and exercise. And that is where I have been able to get the best results. As a result, people don't have to come in 3 times a week for 6 weeks, 8 weeks, 12 weeks. Right. Those physical therapy prescriptions are based on insurance-based providers. And those type of providers need to see a volume because of the declining reimbursements.
Sure.
We are a profession that is not looked at very favorably by the insurance company. What our services are worth is not what we're getting paid. We are terribly undervalued as a profession. So as a result, I have distanced myself from insurance companies. Yeah. The only insurances right now that I will accept is Medicare and Highmark. That's it. If you're in network with anybody else, I'm sorry, I can see you out of network, and I will be more than happy to provide a super bill so that you can submit on your own to get reimbursed the out of network rate. But it's not worth my time and my effort with the reimbursement that we're getting from some of these commercial insurances.
Right. And, for as hands-on as you are, you're putting a lot of time into this, and you're not just doing these other modalities that are based on the research is not helping, but you're really in it with them, and you're solving the underlying problem. And that takes time. And I appreciate, you really caring about the patient and really trying to get in there and focus on what's important, what's not just going to put a Band-Aid over this. Like you said, if you wanted to take, an aspirin, go take an aspirin. Like, that's going to cover up your problem. But if you want to get beyond that, I'm here to do the work with you. And I think that's what people are looking for.
What's the most important thing that we have? Time. Time is the only thing that we can never get back. Yep. So I'm not going to make people come in and do things that they could do on their own at home. That's a waste of time. Yep. We have to provide value, and providing value is doing the things that they can't do on their own. As I tell every person that comes in, there's 168 hours in a week. I will be seeing you for 2 of those 168 hours. Yeah. So when you sign my consent form, you are signing your name that says you will be a willing participant in your rehabilitation. If you think that you're going to come in twice a week and you're going to sit back and not do anything that's going to help yourself,
sure,
I'm not your person.
Yeah.
You need to do your homework. And as a result, people get better in less than half the time of standard care, because I can spend more. I could do more in one treatment than most places can do in 2 or 3. So I'm saving them time, and I'm saving them money, because there's less visits that they have to come to physical therapy.
I love that.
It's a lot of time. That's a lot of time. People have to go 3 times a week, and they have work, and they have family, and they have kids, and they have other activities. Those are things that people look at when they decide, is my health worth this?
And I love how it's very reasonable. Like, that is very reasonable for people. Yes, they can get on board with that. And yes, if I do my homework, then yes, I spend 2 hours here, do the rest at home. I get better, faster. I spend less money, but I'm getting great treatment. And so I love that you're bringing this up because, you know, I've seen a lot of people, and this is definitely against some of the standard. And I think this is really, really cool that you're doing this. And I think the people that are listening the light bulb will turn on. And I think what you're doing is wonderful. And I really appreciate you being here and talking to us about all this.
Well, thank you. Plus, you get more invested people. I
Yeah.
mean, people that are invested in their health do the best.
Yep. 100%. So for the people that are listening, if you would tell us how they can get in touch with you if they're watching and they're like, yeah, I want Dr. Dave, he's the man. So if you can just let us know how they can reach out to you, whether it's your website or phone number, that would be great. And
So all my information is on my website, which is www.wildermanphysicaltherapy.com.
Perfect.
I'm on Facebook under Wilderman PT, Instagram, Wilderman PT, Twitter at Wilderman PT.
Fantastic. No, it's great. Thank you for sharing your story with us and your practice. And we hope to have you back very soon again.
Well, thank you very much. I appreciate you reaching out.
Thanks, Dr. Dave.
Thanks.